Another trial of interest, a series of studies that were presented at the oral abstract session looked at the utility of prostate-specific membrane antigen PET. And there was a very elegant study that was done to try to look at the utility of PSMA PET in the context of patients with biochemical failure. PSMA PET, as many of you know, is actually widely available in most parts of the world, but not in the United States. And part of the reason for that is that the US FDA looks at PET tracers as drugs, and therefore they go through different regulatory processes. So while this has been broadly available around the United States, this particular study presented was part of an FDA process to try to gain additional data so that they could take that into consideration as they think about approvals. So what I take away, and there were a couple of other PSMA or PET tracer studies, and there are different PSMA type of assays, but when we talk about PSMA PET, there are a couple of them, is that these assays are clearly more sensitive than both conventional imaging, and I think there's compelling evidence to suggest that the currently approved agent, flucyclovine, that PSMA PET is a more sensitive assay. This is coming. I don't think there's any question that we're going to see PSMA PET approvals probably sometime later this year. I think the data that was presented, again, is a stepping stone to sort of give you that infrastructure. I would just point out that one of the challenges as we get more sensitive assays is that the concept of oligometastatic prostate cancer, low volume metastases, is increasingly going to be defined in patients with PSA-only disease when we use more sensitive assays. The problem is that all of our therapeutics in prostate cancer have been developed in studies using conventional imaging, bone scans and CTs. So we're going to be in a really uncertain place for a number of years as we do the kinds of clinical trials to answer questions. But in the meantime, you order a PSMA PET in your patient, you have findings, you have to make a decision about sort of how to intervene. So I would urge our viewers to sort of look at those studies and begin to think about this sort of quandary, because it's unequivocally